Hi, everyone. Welcome to our June edition of our Ask the Expert interview series. We have Dr. Brennan Greene from the Eye Care Institute here in Louisville with us today. So thank you for being on here today talking with us about cataracts.
Well, thank you for having me.
Thank you. I'll let you go ahead and introduce yourself and kind of what you do at the Eye Care Institute, and then we'll jump into our questions today.
Well, as she said, I'm Brennan Greene. I'm an ophthalmologist. I'm a general ophthalmologist from Louisville. I went to Bellarmine undergraduate and trained at U of L Medical School and residency. I've been in practice with the Eye Care Institute for about 25 years now. I focus on general ophthalmology, which means I deal with glaucoma, cataracts, diabetes, all the usual general health things we deal with the eyes. And our practice basically includes two other general ophthalmologists and cornea specialists and one optometrist. And we can take care of people's eyes from birth to death at this point.
Very good. Well, thank you again for being on here with us today. So June is Cataract Awareness Month, and we just wanted to do kind of an overview of cataracts from very simple. First question is, can you explain kind of how and why cataracts develop?
Absolutely. If you remember from your high school anatomy, the lens of the eye focuses light onto the retina. As we all age, the lens of the eye becomes less and less clear. When we're born, it's crystal clear, and then as we age, it becomes less and less clear, eventually getting to a point where it blocks enough light from getting in that it affects how we see. And when it becomes visually significant, meaning that it's affecting something that we do, whether that's driving or reading or doing things that we enjoy, then we talk about fixing it. And we fix that with cataract surgery. Cataract surgery is the surgical removal of that hazy lens of your eye. And in its place, we replace it with a plastic lens implant.
So is there a certain age group that are typically more known to have cataracts?
Absolutely. And as I said, it's an aging process. So we usually see it in people in their 60s and 70s and 80s. But that's not to say some people don't develop it at an earlier age. There are certainly people who develop cataracts in their 40s and certainly done cataract surgery on people in their 40s. But for the most part, it's an age-related process.
Yeah. Is there anything that we can do to help reduce the chances of this happening, or?
Not usually. For most of us, it's genetics and age that cause this. Certainly, there are certain things we can do health-wise to help, and that things like cigarette smoking can speed up the process of cataract formation. Uncontrolled diabetes can speed up the process of cataract formation. There are certain medications, and you can talk to your doctors about that can speed up cataract formation. But by and large, just staying healthy and following your doctor's instructions is the best thing to do.
So what are the first signs or symptoms of developing a cataract?
Probably the first symptom that most people get is a symptom called glare. And what that means is that the cataract scatters light as it hits it from a certain angle. And if you've ever experienced driving with a dirty windshield, sometimes when the light hits it a certain way, suddenly you can't see well because the light's scattering off that dirty windshield. Well, the same process happens with cataracts. As they begin, they scatter light. And so in certain lighting situations, you may notice that you're not seeing well. When you're driving at night and the headlights spray off the cataracts, it may cause you not to see as well at night. So night driving is one of the early problems that people experience, or certain lighting situations. For example, I tell people sometimes you find a certain seat in your kitchen that you can't sit because the sunlight hits you a certain way, you just can't see. Then slowly, as the cataracts develop, they begin to affect the distance vision. So you may notice, I've got to get closer to street signs to see them now. Or I'm noticing, more problem driving because I can't see the signs down the road as well as I used to. The reading and the up close vision is a very late effect from cataracts. So most people don't notice that. It's usually the distance vision that's affected.
So if someone is starting to have those symptoms, not feeling comfortable driving at night, having trouble seeing distance, what should they do?
Well, they need a good thorough eye exam, including dilation of the pupils to look at the cataracts and also to look to make sure there's not other things going on, because there are certainly other eye diseases that can affect vision, including glaucoma and macular degeneration. So having a good, regular, thorough eye exam is just very important.
You mentioned earlier cataract surgery is the treatment for cataracts. Are there different types? I mean, or is it just one?
No, cataract surgery, it's been around for a long time. It's the surgical removal of the haze lens. In this day and age, we've gotten to the point now where we do small incision, no stitch cataract surgery. We don't really use much numbing medicine anymore. We use numbing drops, maybe a little sedation either through an IV or under the tongue just to relax you. But for the most part, it's fairly straightforward. We use ultrasound to help break the cataract up. In the last few years, there's also been developed some laser technology which can assist in cataract removal. But most of us have found that the laser doesn't really add anything, doesn't make it safer, doesn't make it quicker. So for most patients, that's not a necessary tool that we use. So using the ultrasound to break up the cataract to remove it, and then, again, putting a plastic lens implant is how we do it.
Okay. Speaking of those lens implants, so it's my understanding that there are different types of lenses that can be put in. So can you just give us a brief overview of some of those common types?
Absolutely. Lens implant technology has been around now probably for 50 years or longer. The traditional lens implant is what we call a standard or monofocal lens. It corrects for one focal distance. It does not have any astigmatism correction. So if you don't have much astigmatism, the monofocal lens can give you very good distance vision. If you do have astigmatism, the monofocal lens, you'll still require glasses for distance, and then you'll definitely need help for up close. So more than likely, if you get a monofocal or standard lens, you will still wear glasses after surgery. About 5 to 10 years ago, actually maybe a little longer than that, the toric lenses came out. And these are lenses that also correct for astigmatism. So if you have significant astigmatism, a toric lens can give you much sharper distance vision. And so you'd have good sharp distance vision and then probably just wear readers for up close work. And then more recently, the multifocal lenses have come out, and these help correct for both distance and up close. And they do a very good job. Are they perfect? No, but they do a good job. And probably for 80 to 85% of the things you need to do, you would not have to wear glasses. You have good distance and good up close vision. So now, over the last few years, we've had more and more options, which have kind of freed people up after cataract surgery that they may not even need to wear glasses anymore.
Yeah, that's great. So what is the typical recovery time for cataract surgery now?
Well, cataract surgery is an outpatient procedure. We do one eye at a time. The procedure itself takes 10 to 15 minutes to do. As I said, minimal anesthesia. Most people resume normal activities, the next day. If you do get some IV or sublingual sedation, we probably do recommend not driving for 24 hours after surgery. But we see you the next day in the office, and if we feel like things are going well, we can release you to drive at that point. But most people, as I said, resume normal activities, usually restrict people to no heavy lifting for about a week, not getting dirty water in the eye for weeks, and no swimming for about a week, and just being careful in the shower not to get soapy or dirty water in the eye for a week. Usually do recommend wearing a little protective shield at night for 1 week just to keep from bumping or accidentally rubbing the eye while you're asleep. But other than that, usually recovery is very quick and painless.
Awesome. So, well, that is all of my questions that I had. So just want to thank you again. Do you have anything else regarding cataracts or anything else that you would like to share before we leave here today?
Well, thank you for asking. I think I would just tell people, you've probably heard of cataract surgery when maybe your parents or your grandparents had it done. It is a completely different surgery now than it was 25, 30, 35 years ago. In those days, we had to put people in the hospital. We used a lot of stitches because we had to make larger incisions. Nowadays, with the small incision cataract surgery that we do, the recovery is so quick. People bounce back very quickly. So there's no reason, if you're having difficulty with your vision, to hold off on cataract surgery.
Yeah. No reason to delay and just live with that longer.
Exactly.
So, yeah, well, again, thank you so much for being on here with us today, Dr. Greene. We really appreciate you and everything that your team at the Eye Care Institute does. And thank you for helping us just get information out there about cataracts during Cataract Awareness Month. So thanks again, and we will see you soon.
Thank you very much.